Hi, everybody. This is Sarah Martin, and I'm the Assistant Director for Graduate Admissions here at the Duke Global Health Institute. Thank you for joining us today for today's virtual open house for admitted applicants. In just a moment, you'll meet 4 of our current students with the opportunity to ask them any questions you have about what it feels like to be a student at Duke. But first, I wanted to give you a brief overview of the cohort that you might join if you choose to attend. Alexis, can you share the screen again with the second slide? I just wanted to give you a brief sort of view of your potential cohort if you choose Duke. We've been really delighted to read all of the applications this year. And recruiting for our 14th cohort in the program. In a few ways, this pool has been really consistent with past years, including the students you're about to meet, full of really interesting, well-qualified students with a unique point of view and reason for pursuing graduate study in global health. In other ways, though, it's shaping up to be a really unique cohort. Very internationally diverse, with more of our applications coming from international students than US citizens. And also a really female-dominated cohort, which is not totally atypical, but is more so this year. If you're comfortable doing so, go ahead and introduce yourself and where you're coming from in the chat. If you choose to come to Duke, you'll join an outstanding community of peers and colleagues, including over 300 Master of Science alumni to date. Your closest relationships will be with your cohort, though, and the cohorts on either side of you. And with that in mind, we'll turn it over to our 4 current student panelists. Nathan, Dom, Stephanie, and Jean, I'll have you introduce yourselves in just a minute, but maybe give everybody a brief sense of your research or practicum projects, what you were doing before the program, and why you chose to come to Duke. Participants, you can unmute and ask questions after these introductions, or you can add them to the chat as we go. Please don't be shy. I do have a few questions I can ask as you're formulating your own, but we'll go ahead and get started, and we'll start with introductions. Jean, why don't you go first?
Hi, good morning, everyone. Thanks for joining. My name is Jean. I am from Pennsylvania, and I am a second year. Before coming to Duke, I have about 4 years of experience in environmental, occupational health, and security with a couple different companies. Why I chose Duke, there's very few programs that you can integrate global health with other topics such as like occupational health. So that was one of the main reasons that I chose Duke, and I got very lucky in my decision.
Nathan, why don't you go next?
Yeah, I was going to say, I guess I'll go next. I'm also a second year in the program, and I guess I'll say my name first. My name is Nathan. I'm from Kansas City, Missouri, here in the United States. And before coming to Duke, I was a Peace Corps volunteer in Nepal, working on food security and agriculture projects. And then decided to come here to deepen my kind of research background. Over last summer, I was involved in an internship with RTI International here in the Triangle area, doing diabetes research, very data-driven sort of research that I was involved in. And I've been involved in a smattering of other things while here. I'll pass it to Doms.
Thanks, Nathan. Hello, everyone. My name is John Fowley. I'm a dental surgeon from Nigeria. I come from Abuja, Nigeria. So prior to coming to Duke, I was working with the Nigeria Center for Disease Control. I was a field agent, and I basically helped curb the spread of the COVID-19 pandemic in Nigeria. Currently, the research I'm working on is largely a secondary analysis. We're creating a mathematical model to forecast basically the advantages of a mental health and life skills intervention called SYV in adolescents, young people living with HIV in Tanzania. Why I came to Duke, it just seemed like the right mix of everything. It had, the faculty is amazing, and then the fieldwork component of the curriculums, it was a huge appeal. So yes, please send me a message or something. I'll respond to that. So yeah, did I miss anything? I think that's pretty much it. Thank you.
Great, thanks. And Stephanie.
Hi, everyone. My name is Stephanie. I'm also a first year in the program. And before coming to Duke, I was taking a gap year between undergrad and grad school, and I was interning with Global Ties Detroit, doing citizen diplomacy work and working with the US government on that. And so within my research here at Duke, I'm looking at kind of the governance factors that were enablers and barriers to Peru's pandemic response. And a lot of the research I'm doing now is looking at diplomacy factors surrounding vaccine donations during the pandemic, and then really trying to scale that up to understand different regional and global factors that are impacting policy and governance during pandemics like COVID-19. And so I chose to come to Duke, kind of like Dom. It was the best kind of combination for things from my point of view. One of the big things that stuck out to me too was Duke's global kind of reach and scope compared to some of the other programs that I had applied to, especially going into global health, which is a really international and collaborative field. I think being at an institution that really values that and helps set you up for that career is something really impactful. And then really just being able to be involved with and take advantage of all of the amazing resources that our program and school have was a big deciding factor for me as well. So happy to go into more detail or answer any questions you may have.
Thanks, Stephanie. While we wait for you to put questions in the chat or unmute, I'll start with sort of a broad question, but acknowledging, and we'll let each of you answer if you wish, just unmute and jump in. Acknowledging that COVID has been a factor in the last 2 years, tell us or our participants what the student community is like at DGHI, and have you found faculty and staff accessible? Have you made connections within and beyond your cohort?
I can hop off mute. But I have really loved being part of our cohort here at Duke. I think, being part of a program that's really small allows for a lot of collaboration and relationship building from really the start of orientation last year. So that's been really nice to kind of build those connections. And it was interesting because for me, my cohort started in person, but then during the second semester, we had to move online for a few weeks because of COVID. And really seeing how accessible professors were to like meeting one-on-one or having, extra space online for us to meet and do work together or ask any questions was really nice, and really just shows what a good support system you have here at Duke, both in terms of your own cohort, who have become like lifelong friends already, even though I've only known them for a few months. It feels like we've known each other for years. And then also having that support from the education team and then the professors as well, throughout the whole kind of duration of the program and afterwards.
Yeah, and just echoing off of Stephanie about the faculty support. So me and Ethan are the cohort class. So our first year was completely on Zoom. So meeting most of our cohort for the first time in the second year was hard, but there were so many great events, of course, on Zoom for the first year that professors would reach out about. And because like if some people would have difficulty learning on Zoom, faculty were very receptive to, helping get us through it. Like Stephanie said, kind of like more on a one-on-one level. So that was really great to see.
Jean, I was about to say the same exact thing.
Read your mind.
Yeah, our experience was very unique in the sense that we were virtual our whole first year. And even still, I found that it was really easy to access faculty and set up Zoom meetings with them, get involved in things, and kind of move from there. So it was a time to be flexible, but still rewarding, reflected on the program that way.
Yeah, so like Stephanie, I'm a first year, and our experience is very different. We are lucky to be in person. The cohort is amazing, so supportive. It's the best thing about the program. Besides that, accessibility to the faculty, I must say that the faculty are readily available. We don't have any trouble really, connecting with them for anything you need, really, even besides, the academics. Grateful for that as well. Yeah.
So one of our prospective students has asked how you went about choosing your research practicum or fieldwork. Who wants to jump in there?
I can jump in. This is still like a pretty fresh kind of experience for, the first years, because we had just gone through that a few months ago. But so essentially the way the process works is in the fall semester, you'll get like a virtual packet with all of the opportunities that you have for fieldwork, or all of the opportunities that mentors are offering. And you kind of go through a match process of interviewing with these different professors or staff members about their projects. And the way that I approached it, I'll start by saying that last year when I was joining one of these meetings as an admitted student, someone on the call, I don't know, Nathan, it might have been you, it was someone who was in the cohort, and they said, pick 2 out of 3 things when you're going about this, like either the location of your project, the mentor that you want, or the topic that you're interested in, because it's really rare that you'll have all 3 of those. And then for me, I'm going into health policy work. And so what was important for me was to try to really find a project that would help me build skills for policy, and really have a professional development component. And so that's really how I went about narrowing my project. And most of the projects will already tell you where the fieldwork is, because I know one of the questions was about, do you get to pick your fieldwork location? And so if that's what's really important to you, you can narrow down the projects that you want to do based on that location. And I will say some opportunities do have that flexibility. Like in my case, the mentor that I'm working with, I was really fortunate. He has a lot of connections because I'm doing my work through the Global Health Innovation Center here at Duke. And so I had a lot of flexibility in picking the location that I wanted for my field work. But most places do already have that location kind of listed in the packet that you get. And so those, I think, are the biggest things to really consider when you get here and are thinking about where do you want to do your field work, or what project you want to work on.
And then Stephanie hit like all the key points. And I just wanted to note for funding. So the funding is extremely generous, and there are a lot of great additional awards that you can apply for. So if you did want to hire like more translators for like interviews, or you want to like download like statistical like packages online too, like there's a lot of great resources. And let's see. Yeah, so funding's great. So in case anyone was wondering about that as well. That was very generous.
Yeah. So field work. Yeah. There is a so basically, I believe Stephanie described this, but you would have a variety of options to pick from based on your interest, and of course, like where you want to go. In my case, my primary interests was health systems, so I tailored it in that direction. And I was fortunate to, match with my mentor, Sundu Buji, who primarily, who works in that discipline. So you'll be spoiled for choice as regards like where you want to work and who you want to work with and the projects you want to work with. So that's a great thing about the program too. So.
Another question from Faustine in the chat is just what multidisciplinary or interdisciplinary feels like. at DGHI or within your research group. Talk about some of the ways in which you're working across disciplines through your program.
Well, I'll start and say one thing that and one of the reasons that I chose to attend here at DGHI, and one of the things that I've really loved about my education and my time here is the sort of interdisciplinary nature of the program, where you have faculty members from all over Duke that also have appointments here at DGHI. You have public policy folks, you have business folks, you have people coming from the School of the Environment, and of course you have people from med school and nursing school, and it's all overlapping. And so you have access to these members of our faculty who have very different backgrounds. And so while you are going about your research, it's really easy to reach out to somebody and say, hey, I have this curiosity in this kind of domain. Can you point me in the right direction? Can you help me out a little bit? The other thing that I've really enjoyed is accessing courses in other departments throughout the university. So I've been taking GIS courses while also here at the Global Health Institute, and it's been just combining sort of a multitude of interests of mine with the goal of furthering sort of my research kind of methodology background has been really enjoyable for me. And so, Faustine, I hope that answers some part of your question. I don't know if somebody else has another opinion on like working within a team that's multidisciplinary. Since my internship was outside of DGHI, I have a little less to say about that.
Hold on. All right. So I would say that the interdisciplinary nature of the program, even, you know, it's down to the level of your cohort, right? So in my cohorts, we have an economist in there, we have engineers in there, we have doctors, we have from all walks of life, really. So and yeah, it even translates to the team that you'll be working on. So everyone comes in with like their different strengths, and ultimately it helps you know, give like a more wholesome experience, you know. But yeah, that's what I'll say.
Yeah. Oh, sorry, Sarah. I'll just hop in.
No, go ahead.
Definitely echoing both of those kind of points, especially, you know, for our cohort being so like tight knit and having those experiences with people who come from different like academic backgrounds or different professional backgrounds. And some people have been working for a few years, other people are straight out of undergrad. It makes for really impactful and like deep conversations and teamwork when we're collaborating throughout our classes. And we really just push each other to see things from different points of views or different perspectives. So I've loved that part about this program, and the field overall is just like how collaborative it is and how you get to really just see things from different people's point of view based on, you know, things like their background in academia or whatever discipline that they're coming from and bringing to the table.
Thanks, Stephanie. Anna in the chat says, how is it living in Durham in the Triangle area? And I'll expand that out to say, like, where do you live? And what would you recommend for prospective students?
I can go first. So in Pennsylvania, like I live right downtown in Philadelphia. Go Eagles. But I was worried about going from kind of like a hectic city life to coming out to Durham, but it's like there's actually a lot of stuff to do. So it was a really easy transition for me, at least. I enjoy it. I mean, there's so many things within, I mean, not only like within walking distance, like you can easily go downtown, and the food and different attractions are great here, but you also have beaches a couple hours away. Asheville's an amazing place to go visit. You have Raleigh, just don't go near UNC. Just kidding. So that's been great. And I live probably just like a 10 or 15-minute walk from West Campus.
Yeah, I agree. Durham and the RTP area is really nice to be in, especially, as a grad student right now. And like Jean saying, there's always something going on, which is really nice. And there are so many different places to explore. Like I've been here a whole year and I feel like there are so many new places that I want to like go to and see. And the nice thing too of like being in this cohort that's small is like forming those friendships. And so almost every week there's groups of us that are going to like events either on campus or off campus or trying out like a new food place. And then like Jean said, the placement of Durham and Duke is really nice and unique because you have like Outer Banks and beaches a few hours away, and then you have the mountain scene a few hours away, and really cute towns in the area. So you can do weekend trips. And on breaks, there's like so much to explore. I live on like near 9th Street, which is kind of this street with different shops and food places that a lot of students go to hang out. And I am about a 15-minute walk from campus. So it's really nice because it's easy for me to get to and from classes, or if I have a meeting, I can quickly get to campus. And everything is pretty nearby and with walking distance. So there's a lot to like see in a lot of different places to live.
I'll just give a quick perspective from my own that I bike around town. So I don't make it out to the coast quite as much. 2 hours driving is a bit much for biking, but the town is super bikeable and it's really easy to get around on like the bus system here from downtown to campus and campus to apartments. And that makes, living here in town a really nice experience. And there's, like people have already said, there are restaurants, there are breweries. Now that the pandemic is kind of lifted for the moment, people are out and about. There are events being held pretty consistently now. So anyways, the town is bikeable. It's fun. Let's see, we have a couple more questions in the chat though.
I like that. I will plan to get a bike next semester, so I can bike around as well. But yeah, largely it's mostly hanging out with the cohorts. Like, I believe we've hung out a couple of times, Stephanie. We're pretty close to like Main Street, and Main Street like has a ton of restaurants and places like one could visit. I haven't ventured too far, and I live pretty close to school, about 10 minutes away. So yeah, and I think it's pretty easy to like get a place like super close by. So yeah.
And I see one question. I don't mean to skip over question 4. I'm sure we can do that right after. But one of the questions for the average rent cost in Durham, just because we're on this topic already, I just Googled it. It says 1,400, but there are definitely places really close to campus that you can get for much less. So don't let that kind of 1,400 number, if that scares you, don't let it don't let it scare you away, because you can definitely get a lot closer. And there's a lot of people that room with each other in the program too. So even just sharing apartments, the cost of living will be way less than that.
Thanks, Jean. I was just going to say there's a real range, but it helps to have a roommate for sure. There are questions. I'm so excited to see all these questions. What is the student culture like at Duke? And I'll sort of combine them because there's one on student culture, working in groups. How often are you working in groups as part of your courses? But also, what is the workload like as a Duke student? And I encourage all of our student panelists to also read the questions because I'm paraphrasing very much. So. Does anyone want to jump in about workload or student culture?
Yeah, I'll go. So we do have a lot of like discussion group work in a lot of our classes. I'll say the second semester courses are a lot more based on kind of teamwork, especially in our core classes, which has been really nice. There are a lot of projects where you work together, and that does help, kind of like I was saying earlier, not only to kind of push ourselves to learn from different ways, but also it allows us to learn from one another. So we're not only learning from like our professors, but we're also really getting different skills from one another. So like we have an economist in our program. I haven't taken an econ class in maybe 6-7 years. And so being able to learn how to apply that to like health and health systems from that perspective has been really nice. And so that does just allow us to kind of work together and also better build those relationships and better understand the course material. And then in terms of workload, the first semester is a lot, at least for me personally, I found the first semester wasn't as heavy workload as the second one. But in your second semester in the spring, you're also planning your thesis field work and getting ready for the summer. So it is a lot more work in that sense, but like the professors are really flexible. If we say, you know, we're really stressed, there are a lot of exams or a lot of projects this week, and they're flexible with moving deadlines, which has been really nice, and it takes a lot of the stress off. But I think just like having that in mind when you're planning, like when you get to campus, if you're doing like a different job or you want to take on extracurriculars, just being cognizant that like the fall semester is a lot, or it's just like more laid back in a sense. You have a lot more time for extracurriculars. And then the spring, just because you have the field work, it's a little bit more.
Yeah. Yeah, Stephanie pretty much covered it all. The workload in the spring, definitely, because you just have, you know, research work you're planning for. But then, like she said, our professors have been pretty flexible, you know, like really concentrate in that regard. As regards, what's the other thing now? Oh, working in our teams. But yeah, yeah, you. I think it's the curriculum is kind of designed to reflect the like what you know do when you finish. So there's a lot of team-based activities. I think pretty much every course has something of the nature. So yeah, you would find like a lot of that here. So.
What other activities sort of beyond global health have any of you been a part of on campus? I know, Stephanie, you're part of the Margolis health policy program, and you tell us a little bit about that.
Yeah, so I'm, like Sarah said, part of the Margolis Scholars Program, and that's an interdisciplinary professional development and skill building program on campus. And it's, again, a small cohort, but it's really nice because people from every disciplinary on campus apply. So there are like lawyers, students doing an MBA, students studying environmental, like the environment. And so it's been a really neat way to network with people who are involved not only on Duke's campus, but throughout the US and the world in policy. And it's been really a great opportunity for me as someone who's going into policy when I graduate to be able to attend weekly meetings and learn about research that's being done in the field or about different job opportunities. And so it's really a program that's built on networking, collaboration, getting leadership and community service skills, and then really just getting more exposure to policy. So if that's something you're interested in, I definitely look into that scholars program as well. And it's essentially like a certificate to your degree. And there are a lot of things you have to do as part of the program, like take certain courses. But the nice thing is, like so far I've had 5 or 6 of our core classes count for my Margolis classes. But that's been really great. I'm also on the Duke ballroom dance team. So if anyone is into dance or like arts, there are so many different clubs and things you can be part of, even as a professional student, a grad student. So it's not just, you know, academic things to be involved in.
Yeah, harping off what Stephanie said, I agree. I mean, there's dance groups, there's music groups, that you can find pretty much anything. And like Stephanie said, it's not just for undergrads, there's plenty of graduate opportunities too. We also have like within Global Health, like I'm one of the co-presidents for our Global Health Graduate Student Association. So we're in charge of helping different like social and professional events for both the first and second year cohorts. So yeah, there's definitely a lot of, like if you have an interest, you most definitely will find a group at Duke for that.
I'll chime in and talk just really quick about my Bass Connections experience. So along with my internship, I was involved with sort of a more localized hands-on experience, working with the health clinic here in North Carolina to extract and then analyze some of their pharmacy data. And so was pretty involved with that my whole first year being in the program. And so I was working with stakeholders and was working with like the clinic director to develop the analysis, but was also working with a cohort of undergrads who were also working in a similar function, or like in the same county that I was working in and within the same kind of health department network, to develop sort of programs within their own health department. And that was a really rewarding experience because I got to, interface with undergrads, interface with folks here in the local community, connect with faculty members. So I was pretty involved with that. My second year here, like I mentioned, I've been involved over at the Nicholas School of the Environment Learning, geospatial analysis, which has been really fun. And I've made a lot of connections over at the Nick School. But apart from that, I've also been pretty active sort of in the recreational domain on campus. I play a lot of sports, I play a lot of basketball. It's pretty easy to get involved at the recreation centers. I saw a quick question that I'll just clarify. I shouldn't say it's not clinical experience. Like I'm not an MD, I'm not a doctor. I was working as a data analyst with a health clinic or like a health post here in North Carolina. So, but that was through a program called Bass Connections, which is like a student practicum research program here at Duke. That's an opportunity that if you were to attend, that would be something that you could get involved in really easily. There are lots of faculty here at DGHI that also have projects running through Bass Connections. I'll type the name out in the chat. You can look it up on Duke's website. There's lots of information about different projects that people have done and all kinds of things that Bass Connections runs.
Yeah, and just to add on that, I know a lot of people in my cohort, including myself, are doing a Bass Connections team our second year. And so it's something that a lot of people choose to do their like the second year of their program, because in the first one, you'll be having your research apprenticeship with your thesis mentor. And so it can be a little bit much to take on 2 research positions. But then in the second year, a lot of people have more flexibility, and that also lets you get like a broader experience in research and to have exposure to different types of projects, and also get kind of more experience working on a team with, like Nathan was saying, undergrads, different professors, different organizations in the local community. And so that gives you kind of that local and global perspective to global health by being involved in those different projects.
There's a question from Purity who asks, how has the program lived up to your expectations? I think that's a very individual answer, but I'm happy to have anybody respond.
Not a biased answer at all for me, but I would say it's highly lived up to my expectations. But also depends on you, right? So you come in and like you have certain interests. Like I like engineering management, so like Nathan talked about, it's very easy to take courses in different departments. So I gotta have like strong connections with the professors and students when I took them as my electives. And so the connections that I've gotten out of that have helped me with like my future, like what I want to do like after Duke. So there's so many opportunities, but it's also like personally, like you also have to come in and, you know, kind of reach it. There's so much support. So it's easy to kind of go for what you want. But yeah, I would say it definitely lived up to my expectations.
Yeah, I agree. It's definitely lived up to mine as well. Like for me personally, I love pretty much all the classes that I've taken my first and second semester of the first year, including the core classes that everyone takes together and then my electives. And I think it's just been really interesting to be able to take all these different classes, things like health systems. I'm in a health policy course. I took a class that focuses on non-communicable diseases. And then really just the way that the program integrates our field work. Like I love my thesis project and I'm really excited to be doing this research over the summer. And I really do feel like it's helping me get to where I want to be professionally. And so I think looking at all those factors and then just the connections that you make in the program with your cohort and then with faculty that are really eager to like network with you, help you connect with some of their contacts in the field that maybe aren't at Duke, but that can help provide more professional guidance or maybe work with you. And really just how eager everyone is to help you as a student who's kind of finding your way in the field. It's been a really great experience.
I'll hop on now. So yeah, I would say that to a certain degree it has surpassed my expectations, especially as regards picking up hard skills. Prior to coming to Duke, I was a clinician, and that was pretty much all I knew. But in the span of barely a year, I, to some degree, and of course, thanks to Nathan as well, can, you know, like code using R programming. I've also picked up like other skills. I can use Vensim. I didn't even know about Vensim before coming here. I can use Vensim to like model for systems dynamics modeling. For my research project, I'm gonna like learn to use another software called Triage. So that's primarily for economic analysis and everything. So hard skills like readily available. You just have to. It just has to be what you're interested in, and you'll find your way towards it. But that's pretty much it.
Well, you're muted again very quickly, but there was a student sort of directed a question directed at you, and as an international student, many of our guests today are also international students. Can you talk a little bit about support for international students and adjusting to Durham and what it was like to sort of shift from Abuja to Durham, how you've settled in?
Yeah. The adjustment aspect, I mean, it takes some getting used to. But along the way, there have been, you know, so many people like really helpful. I remember when I first got here and I was trying to settle in, I had classmates, friends, colleagues who were very helpful in helping me adjust. My neighbors, I have my Lisa and Vivian, they're my neighbors right there. You know, they're always available to, you know, help, you know, with anything. And even to some degree, like the program as well too has, you know, try to be there in that regard. So, I mean, it's a change. It's a huge change, but it's one that you can be, you know, fairly certain that you would receive, you know, guidance and support along the way. So.
Thanks. Another question in the chat is, oh gosh, there's so many. I love this. What career paths do each of you plan to pursue? And I'm just going to add a tag on like joining the master's program. Has that sort of expanded or narrowed your career path in any way as you sort of move through the program?
So my plans after graduation, not sure what branch yet, most likely Navy, but I'll be joining as an environmental health officer. So a lot of even my thesis work, like working with zoonotic surveillance, that helped a lot in the decision. And that also helped a lot in the interviews with the Navy. And like Nathan said, the Nicholas School of Environment is such an amazing school here. So I also was able to take some like their quality and toxicology classes as well. So that really helped as well. Even global health classes, because surprisingly, the Navy has a lot of great global health initiatives. So it kind of works out with the timing for it. But I would definitely say my experience here has helped in terms of that.
Nathan, go ahead. Okay, thanks. So I've mentioned it a couple of times, but I'm going into a global health policy and governance career. And so essentially I want to work in health policy, but at an international level with different government organizations. So there are a lot of different ways to be involved with the policy field in different branches of the US government, as well as in different NGOs and then different multilateral organizations like WHO, the UN, the World Bank and Trade Organization have policy opportunities. So that's been really nice to learn about those different opportunities and ways to be involved in policy. And then I will say I knew coming into Duke and when applying that I wanted to go into global health policy work. But the courses and experiences here have really been monumental in like solidifying that decision for me and really helping me feel more prepared to enter that field and that focus of global health. And so it's been really nice that, you know, regardless of if you're coming into the program without knowing what you want to specialize or focus your career path on, or if you know what you want to do, your experiences and the connections you make really help you find your way and get ready to enter the workforce.
I'll go next. So for me, short term, I see myself, I'd like to work basically on health systems. And subsequently, I really hope that I can, combine my my background in dentistry with, the skills that I learned from the program. Possibly a mix of like a clinician with maybe a policy, how do I describe it now? A policy school, a policy program, something of the sort. So I would like to harmonize both my disciplines now. Yeah.
Nathan, did you want to add anything or do you want to?
Yeah, sorry.
Okay, that's okay.
Yeah, so mine's pretty straightforward. I'm hoping to enter the field of med tech as a data scientist going forward. I'm wanting to get experience in industry now that I've been in academia and kind of continue developing my skills as a programmer and skills as a data analyst. So I'm kind of on the data track. There was a question that Sarah, you mentioned before that I'll just touch on, or I guess it was embedded in your question that started us here, of how did you start your kind of with your academic interests and what you wanted to learn, and how did you end out? And I came in super interested in food security and food systems and nutrition, because that was what I had worked in before coming to DGHI. And the beauty of kind of the flexibility of this program being an interdisciplinary program, exposing you to so many different sorts of sectors within global health, is that I was able to really explore a couple different interests and kind of pivoted into this profession of data science as I was continuing to work on projects with food systems and nutrition. So it was a really nice kind of melding of both of those interests of mine, the one new one growing data science interest and an older interest of nutrition and food. So really, really wonderful experience in that way.
Thanks. Another question in the chat is, have any of you experienced imposter syndrome during graduate studies, and how did you sort of work through it? Nobody's jumping in. I think, though, I will say collectively, I think all of us struggle with that at some point in our lives and in our careers. I think that at Duke, we have a lot of resources to support students, including counseling and psychological services, which can be one-on-one, but also group advising. And those are topics that we encourage discussion about in the classroom. So there's sort of a lot of support to help you move through it, but also to recognize that if you are at Duke, you have strengths to bring. And you're here because you deserve to be here. And your point of view is an important one to include in the conversation. So hopefully we mitigate some of that with our efforts on community building. Let's see. Oh, go ahead, Nathan.
Can I just say something on that note?
Yeah.
That I feel like everybody coming in to the program has some sense of imposter syndrome. And as you move into your research experience, you have like this huge wave of, oh my God, I'm not ready for this. I'm the TA for the first year's biostat class. And so I've gotten to see this firsthand after I experienced it the year before, got to see it in everybody else. And I think you get here and you sit with your cohort, even for a few weeks, and you start to realize like, oh, it's like, I have strengths in this area, you know, these people have strengths in this other area, and I can reach out to them for help when I'm like struggling with something. And it's the community is so tight knit in that way that it's very helpful to recognize your own strengths of your peers, and to rely on your peers in that way to kind of move through the program and learn together. So sorry, Sarah, to cut you off. I just wanted to say that a lot of that imposter syndrome goes away and dissipates when you're with your peers. But also the psychological services have been great and have helped me on other levels as well. And they've been a huge resource. Lots of things to access here at Duke.
Thanks, Nathan, for jumping in with that. Yeah, there's an exercise in one of your spring core courses that is even like identify what you're expert in and where you bring your expertise to encourage that peer-to-peer sharing. But yeah, there's a big focus on wellness at Duke and in DGHI. Let's see, what advice would you give? This may be a good concluding question. And there is another question about contacting alumni. Duke has a big alumni database. It is fairly easy to navigate the Duke alumni database to reach out to people. But what sort of advice would you give in terms of preparing sort of that summer before you started your program, thinking back, like what do you wish you had done? Or what advice would you give based on what you did do that was helpful in preparing to join the cohort?
For me, there was like a specific professor that I wanted for my thesis. And so what I did is I emailed him. And I felt like that was like an easy way for me to kind of introduce myself before I got into the program. So definitely if you see a project that you want, even like Bass Connections, like it never hurts to just send out a quick email and kind of be one of the first people. So it is kind of like an easier transition and you kind of know a little bit more than other people coming in if you wanted to join Bass Connections, for example. So I would say don't hesitate to reach out if you see like a really cool project. I'm not sure what the rules are. I don't know if you can start in the summer, maybe like before you come to Duke for some research. Maybe it's possible depending on which professor, but I would definitely reach out if you see anything that you're interested in. I think it helped in my case a lot.
Yeah, I think too, my cohort started like a WhatsApp group before we came to campus. So it was like a nice way to start to kind of introduce ourselves before we met at orientation and just kind of get to know each other a little bit more. I think two people that was helpful for some people who were still looking for housing options to kind of get an idea of where other people in the cohort were planning on living. And then, yeah, like Jean said, really just kind of like look at different field work and like thesis projects you're interested in. Honestly, that was like the biggest thing I did to prepare, was just kind of look at what are the core courses I'll be taking, and then kind of connecting with people in my cohort before coming to campus. But really, orientation will prepare you for like what's to come, and honestly just like try to relax before you come and just like get excited for it, because it's a great time to be in the program, and it's a great program to be in.
Does anybody want to jump in? Uzoma? All right, did anybody else want to jump in on sort of how to prepare? All right. What other, this is my favorite surprise question, which isn't really a hard one, but tell us what your favorite class has been at DGHI, either this first year or comprehensively as you've gone through the program.
I'm kind of a wild card when it comes to this question, but I took a demography class and a population health science course the first semester that I was here, and I loved it. Got to play with spreadsheets, looking at life tables, like assessing population dynamics. That was really fun. And through the Global Health Institute, I also really enjoyed the core biostatistics program. Just the number of methods that you get exposed to in the second semester is a lot of fun, right, Stephanie and Doms? If that's your academic bent, it's a wonderful course, and I really enjoy it, which is why I'm TAing it. But I know other people have enjoyed other courses within the program.
Yeah, I love one of my favorite ones. I can't say one, but one of them is global health and air quality, and kind of like the human health effects from that. Because we talked about like plasticizers and particulates and like other occupational exposure, what I wrote for my fall paper last year was pretty much exactly what I was writing up for my thesis literature review. So I might be a little biased in my answer there, but that was definitely one of my favorite classes. And again, to kind of see how global health integrates with environmental and occupational health.
Yeah, this is a tricky question because I have really enjoyed a lot of the classes we've had, but my favorite has definitely been the policy course that I'm in right now, just because of the way well, first off, I love policy, but the way it builds in both like knowledge building and then skill building as well. And so like you really learn how to implement policy and to do like policy analyses. And there's a cool project component where you're partnered with RTI, which is one of the top global health organizations, and you have a field mentor to really implement like your own policy to address a challenge in that country. And so there are a lot of cool classes like that that you can take where you're really kind of already working with partners and people across different programs at Duke, especially your electives. There are people who aren't just in global health taking them. And so it's been a really neat way to kind of get that experience right now and make impact right now as a student still.
Yeah, in my case, I would have to go with data science and data visualizations. So it's a course taken by Dr. Green, an amazing teacher. Yeah, it really just opened my eyes, broadened my horizons to, what one could, really do out there. So yeah, it's there. And again, I agree with Stephanie, there are many, many fantastic courses. Well, for me, it'll have to be data science, data viz, because it's a new experience, doing computer programming and that one for sure. Yeah.
Well, thanks, everybody. Thank you, panelists, and thank you, participants with good questions. I know there are a couple of emails in the chat for our panelists if you want to follow up with more questions. I know I have a couple of emails to reply to from a couple of you on the call, and just look forward to helping provide any additional information we can as you move forward with this decision. So thank you for joining us today to learn more. Have a good afternoon and evening for all of you.
Thank you.
Bye, everyone.
Everybody.